Hello viewers, we have Professor Dr. Kai Vilanova from Spain, and we are now going to talk about the most happening things in diagnostic, that is MRI. So if you will go to any doctor, any clinicians, they will ask you to do the MRI. So we will ask him and we will talk about what is the MRI and what is the need of MRI for a patient. So only surgery patient can do MRI, or for non-surgery patient can also do the MRI. So over to you, doctor.
Good morning. Yes, thank you very much for this interview, and especially we are talking about an imaging technique. An imaging technique is to take imaging of our body, and we are talking about MRI. MRI is an imaging technique that, without radiation information, in this case, we are going to provide the anatomy, the real anatomy of the patient. And the main indication today to perform an MRI is of any joint of our body, the spine, and the brain. So we can evaluate the whole anatomy from the brain through the spine and all the joints, and what is very important, the high quality from this anatomy inside the anatomy of the joints. And this is the power of this technique. There is no other technique in imaging to see the anatomy as MRI. So if someone wants to see a diagnosis, has to perform an MRI.
Let us know our viewers that what are the powers of in terms of Tesla. So which Tesla a patient should recommend?
Well, this is an important issue that today there is much consideration in our field in radiology, because MRI has different types of MRIs according to the power. So we talk about low field, low intensity, and high intensity. And mainly in the big hospitals, there is high intensity. This means high Tesla. But this type of MRIs are very cost. And today we have constraints. We know economy. We know energy that is very expensive. The energy that this type of MRIs requires a lot of energy. So there is a high cost. And this is why, if it's possible today to have lower energy with this type of MRIs, like the one that we can perform to our patients, low field MRIs, that we can evaluate any patient with a cost effectiveness. And this is the big power of this type of MRIs. Low field examinations that we can perform in every joint and the whole spine with MRI, such as the equipment that we're talking today about, this low field MRI.
So what is the weight bearing MRI and the silent features of ESOT weight bearing MRI?
This is an additional information that we can perform in this unique MRI. This is a weight bearing MRI. What does it mean? This means that the patient is standing, not laying down as the standard MRI. Usually all the MRIs are performing laying down. Then if we perform the examination standing up, this means that we're going to see some findings that probably is the reason of the pain of the patient. And this is very important, because the main role of a diagnostic radiology is to try to find why the patient has pain. And in some instances, performing the standard MRI, we don't see what is the reason of the pain. And whether we perform this MRI a standing upright position, we see changes and we see why the patient feels pain. And this is the big power of weight bearing MRI.
So we have seen the evolution of MRI. So now from zero point 0.5 Tesla to 3 Tesla and weight
Yes.
bearing the MRI. So how do you see the future of MRI?
Well, mainly as in many fields, not only in medicine, but in general, we see artificial intelligence.
Yeah.
And this is the big power that also it's going to be included in this type of MRIs, and even in the weight-bearing MRI. This weight-bearing MRI sometimes takes some time to acquire the images. 30, 40 minutes. What it will provide artificial intelligence? That we are going to acquire probably in 10 minutes an artificial intelligence. It will perform the additional information that it took so many times. So this is for sure the next step to include artificial intelligence in the weight bearing information.
Thank you so much for talking to MedGet Today TV, and we will definitely get in touch with you for latest updates on MRI technology and radiology. Thank you so much.
Thank you very much.